So I'm going to sit down. You want to know how to prevent dementia, eat Mediterranean diet, heart healthy diet. I want you to stay physically active, socially engaged, keep up on all your wellness visits, continue to come here so that we can expand our educational program and outreach and create the kinds of research projects that are of benefit to you. So right now, you're going to hear from Dr. Feng, who's a professor at Georgia State. He is a man of color who's doing research in aging. And one of the things that's important is fall prevention. How many of you have fallen around here? How many of you broken something around here? Okay. Main complication that causes debility in older adults is falling. Breaking a hip can be a death sentence because older people don't recover well from things like that. You develop blood clots and other things. But most people who break a hip in older age generally don't fare well in terms of their quality of life. So he's going to talk about fall prevention today. And next month, you're going to hear from Dr. Park, who's going to talk to us about how to get engaged in education. And you're going to hear from Dr. Alonzo Sexton, who is an orthopedic surgeon, who's going to talk about orthopedic problems that make it less likely that you exercise and stay healthy and what to do about them.
Okay. Good afternoon, everyone. Thank you to Dr. Park for the nice introduction and also some information she presented. It's new to me. Okay. As you can know, like my background is not in dementia. Okay, I'm just trying to do something to help people with like dementia. Okay, so some information she presented was like eye-opening for me as well. Okay. So that's that involves like how great this program is. Okay? I'm glad to be a part of this program. Okay. So as Dr. Park said, my research is about fall prevention in different populations. Okay? But for today's talk, okay, I'm going to do like a slightly different topic, okay, which is like how can we early detect the dementia, in particular like Alzheimer's disease. Okay. So before we dive into that, I would like to provide more information about myself. So my name is Feng, and this is my email address. If you want to reach out to me, you could send me an email. And I'm an associate professor in the department in Oregon Health and Georgia State University, and I'm a biomechanics by training. So for those who you're not familiar with biomechanics, it is a study of the human movement by using mechanics as a tool. So mechanics is a branch of the physics. So after finishing my honor degrees, I completed my postdoc training in physical therapy. So the combination of my academic training and the research experience landed me in the research field of fall prevention. So my main research is to develop interventions which can prevent the falls from happening for older adults or for people with neurological disease, including Alzheimer's disease and mild cognitive impairment. So since we are doing some work with people with Alzheimer's disease, so first I would like to present some numbers about Alzheimer's. It just like to provide like more comprehensive understanding of this disease. Okay, so the Alzheimer's is the most common cause of dementia. Okay, so based on the NIH the data is between 60 to 80% of the dementia cases are dementia, Alzheimer's. Okay. And so in 2025, there are about like 7 million Alzheimer's cases in America among older adults. And the number is projected to be doubled, close to 13 million by 2050. So this is just in America. If we look at across the globe, so this number will be jumped to around 150 million older adults across the globe who will be affected by Alzheimer's disease. So, according to NIH, it's the Black Americans are overall twice as likely to develop dementia than the white people. So, unfortunately, there is no cure for Alzheimer's disease so far. But fortunately, there was a little data, longitudinal studies, which suggested that the Alzheimer's is not avoidable. It can be prevented. It can be delayed. It can be reduce some exposure to the risk factors, so that we can delay the onset of the disease. So that gives us some hope. So if we can detect the disease at the early stage, then we can plan things more accordingly, just like Dr. Park mentioned again. So currently, all the diagnosis or detection will be too late. When you diagnose it probably too late. So if we can detect or catch the disease at the earliest stage. So this chart shows us the y-axis is the level of the brain health. The x-axis is the stage of the disease. So the first one is labeled as preclinical. And the following stage is the mild cognitive stage. And the last stage is the Alzheimer's stage. So if we can catch the disease as early as possible at the either preclinical stage or the mild cognitive stage, so then we can prescribe a treatment or we can seek some clinical trials or help the drug company develop the drugs and also to make some informed decision among the family members or among the individual or the patients. So that's why the early Alzheimer's detection is not only possible, it's also necessary. So unfortunately, currently the early Alzheimer's detection is not an unmet clinical need. So I'm going to explain to that. So currently, the Alzheimer's diagnosis is mainly really relied on the longitudinally documenting the mental decline based on the cognitive assessment. So probably most of you have had a chance to conduct a MOCA test, Montreal Cognitive Assessment. So this MOCA test can assess different the cognitive function or domains of the brain. So your physician can do this type of assessment year after year after year. So until they observe or they spot something which is suspicious which be related to the Alzheimer's disease so then they will just prescribe you with more diagnosis or more tests. But at this time point, so the brain already experienced irreversible damage. It will be too late for us to do things meaningful to prevent the disease. Just like Dr. Hart said, so the damage to the group or the ceiling is already there. So now what we can do to prevent this disease will be very limited. So that's why we needed to detect the disease as early as possible. So another way to diagnose or to detect Alzheimer's is a neuroimaging based technology. So you're always either the MRI, fMRI, or the PET scan or the CT scan. So this image shows us the side-by-side comparison between the images. On the left side is a health brain. On the right side is a early Alzheimer's disease brain. So as you can see, the blue area shows us the deposition of the amyloid beta protein. So as you can see, right, so the health brain. So the blue part the red part is the deposition of the amyloid protein. if you compare these two brain, so it's clear that so the Alzheimer's disease background brain has like so much the position of the protein. Okay? So yeah, this case also like a probably more accurate like the diagnosis of the disease. Okay? But yeah, the drawback of this approach is it's not very accessible to the public. Okay? It may be like too expensive and it's like not affordable to the public. Okay? So another one is just like Dr. Park mentioned, okay, we will do the CSF this test. Okay. So this one can provide also an accurate diagnosis, but yeah, it's not very friendly to the patient. Okay. So then, okay, thank you for your support. So then, we were thinking if we can find something which is easy to do and also is like more clinical friendly to both the patients and to the clinicians. Okay? So that probably could help us to detect the disease at early stage. Okay? So the theoretical for us to early detect the Alzheimer's is that the cognition or cognitive function and the motor functions, they will share like some common brain regions. Okay? So the brain regions, at least some of them, just like the front lobes, the cerebellum, and the basal ganglia. Okay, so these brain areas will play the roles in both cognition and the motor function. Okay? So any like a small or minor change to the structure of the brain in this area will not only affect your cognition, the way you're thinking, the way you're talking, but it also affects the way how you walking. Okay? So that gives us another perspective. Okay? So if we can examine any change to the way the person walk, with that to provide us some early sign for the Alzheimer's disease. So that's like the whole theoretical basis for our work. Okay? So this perspective provides us with another possible tool to detect Alzheimer's early. So this slide shows us the brain image at a different stage. As you can see, as the disease getting like worse, so then there are more leaders and always more strength to the brain. As you can imagine, so the brain is the central control unit for our movement. So any damage to the brain will result in some change in the way you walk, in the way you move things, in the way you move your body segments. Okay? So if we can catch those change in the body movement, so that could give us some hints about the disease. Okay, so based on the literature, so the Alzheimer's disease, it can affect the way the patient walks. So it can affect like several different domains. The first domain is it can worsen the a person's direction or orientation in the space. So the people or the patient, they may not be able to make a correct turn, or they may not be able to walk in a straight line. So they may deviate from the center line to the left or to the right. So this dysfunctions are a sign of the most common the form of the Alzheimer's disease. So the second domain is the change in the arm swing. So studies has shown people on Alzheimer's at the early stage, they will reduce the swing of the arm. So for healthy individuals, when we walk, so the arm will naturally swing back and forth. But at a given stage of the disease, so the strength of the arm will be either reduced or completely absent. So that's another sign of the disease. And the next one is disease can also, at the early stage, can also walk also like affect how fast the person walk. So it can slow the gait speed, the walking speed. So this can happen like many years before the clinical symptoms like appear. So this is another study from Sweden. So they did this study on like on 300 older individuals. So what they did is like I think back in 2000, in year 2000, so they recruited participants. Then they did a cognitive assessment for all the individuals. They ensure all the individuals they are cognitively healthy. Then they followed these individuals for more than 15 years. So in year 2025, they did another cognitive assessment. They measured its speed. Then in year like 2009, they repeated this thing. Then in year like 2015, they assessed their cognition and gait speed. So this is what they found. So at the beginning, because everyone was healthy, so they took like the shortest time. So at this point, they took the shortest time to finish the walking distance, which is 30 meters. As you can see, for those who did not experience like any cognitive decline over these 15 years, which is the proven here. So they showed some like reduction in the walking speed, but that reduction is much smaller than those who had some cognitive decline over these 15 years. So this tells us that the gait speed reduction could be like an early indicator of the disease. So then they did like subgroup analysis here. So for those who, so the problem is the one who showed like a cognition decline or cognition impairment in 2005. So for those individuals, their gait speed reduction was the most of the largest. But for those who did not experience like any cognition decline, which is the orange line, so their gait speed reduction was smallest. So again, this tells us the cognition level is proportional to the disease, like to the gait speed. So the gait speed could be used as an indicator of the early stage of the disease. Then the disease can also affect how long the person take the steps or how fast the person take the steps. We call it the cadence. So for like a healthy adult, the cadence is around like 120 steps per minute. But for people with Alzheimer's disease, this number could be reduced, and also the step length could be reduced as well. So the reason is, so for people with Alzheimer's disease, they experience like so many different like declines in the body systems. So one of them is, they will have like balance dysfunction. So they don't feel like secure. So then to make them feel secure, they will walk slowly. We call that as a cautious decline. Okay. So far I have been talking about the gait or walking without any disruption or perturbation. So we have been walking probably thousands of like tens of thousands steps every day. So the walking has already been like a part of our life. So that's why we are thinking probably we just looking at the normal gait, it may not be able to provide enough information we need because this model task is not just so challenging. So the gate we always use the same region of the brain. So that means if we just look at the same brains, it not may not give us like a sensitive like information. So then we were thinking what if we make the walking more challenging? So one of the options we used is to adopt a special strategy. So this strategy can make people fall. So I'm going to show you a video. So this video is like good lady. She was walking on our treadmill. So at a certain point, then she was asleep. So then she lost her balance. Yeah, as you can see, yeah, she lost her balance, but she was able to recover. She did not fall on the harness. Then we had the same equipment and the same procedure. And then we invite people with mild Alzheimer's disease in the lab. Okay, so clearly he lost the balance, and also he fell onto the harness. If we did not use the harness, probably he would have fallen on the ground. So then, if we compare between the healthy individuals and people with Alzheimer's disease, so clearly people with Alzheimer's disease they have the poor reaction to the perturbation or to the sleep perturbation. So then we also did a different motor cost. So this time, instead of walking, then we just have our participants standing on the treadmill. Then at a certain point, they were sleeping as well. So this for healthy individual. Oh, it's after sleep, she was able to recover the balance. Then for people with mild cognitive impairment. So again, yeah, she lost balance and she fell on the harness. So then we're thinking if we compare their body reactions to the sleep perturbation between people with Alzheimer's disease or MCI and healthy individuals here, will the comparison provide us with any more sensitive information which can help us to detect or to catch the disease at the early stage? So one of the ways for us to look at the data is we compared on the first sleep, the people with the cognitive impairment, 100% of them failed. But for the healthy individuals, around half of them failed. So there's one difference between them. Then we also repeatedly sleep them on the treadmill. So now that gives us how quickly those individuals can learn the new motor skills, but can adapt to the sleep motivation. So as you can see, for the healthy individuals, after 5 hours, so none of them fail. But for the people with movement, cognitive impairment, so after 5 sleeps, there's still around 50% of them fail. So the difference in their response to the first sleep, and also the difference in their capability to adapt to the repeated sleep, there be two different metrics for us to detect the disease early. So another one for us to look at data is we mostly look at how quickly the muscles are engaged to respond to the perturbation. So after the sleep. So this one is we call EMBC or the muscle activity. The first one is when the sleep or mechanical sleep was initiated. This tension is when the muscles are back. It's for people with Alzheimer's disease. So we call this early onset. That tells us how quickly the muscle is engaged. So for people with Alzheimer's disease, it took them probably around 200 milliseconds. But for people with MCI, so this delay or the latency is shorter than in people with Alzheimer's disease. Then for healthy individuals, so that the muscles will engage even early. So not only the timing information is different between these three groups, which basically, the more impaired the person in terms of cognition, then the later the muscles are engaged or initiated to respond to the perturbation. So that's in the timing domain. If we look at how big the muscle activity is, so people with Alzheimer's disease, they show like the largest magnitude. So this tells us how to what degree the muscles is engaged in. So people with Alzheimer's disease, they engage the muscle to the most or to the intense degree than MCI and then healthy individuals. So then you were thinking, so the muscle activity could be another way for us to detect the disease at the early stage. That's like the I talked about the early detection of Alzheimer's disease, and also as Dr. Park mentioned, my research is for prevention. So currently we are doing like two studies. We are doing like two studies with to prevent the falls in people with Alzheimer's disease and mild cognitive impairment. So the studies are funded by NIH and the Alzheimer's Association. If you know anyone who might be interested in our study or who might be benefited from our study, please refer them to us. And so we will provide the parking and some compensation. So besides the fall prevention in people with cognitive impairment, we also do some other sides to prevent the falls in general older adults. So our study basically, one of our studies to look at how the body composition basically is the obesity type, how that can affect the fall risk. So we will do like a free DEXA scan. Basically, we will provide you with the bone density information, like your body composition, and then to examine your fall risk. If you are interested in that study, again, you can just contact us. I think that's it. Thank you again for this opportunity. If you have any questions, please clear.
Just to recap, I think one of the things, and he showed you like the images. If you've been in research, how many of you got the MRI already? All right. How many of you got a PET scan? Okay. So those tests, particularly that PET scan, is like about a $6,000, $7,000 test. And Medicare now pays for that because we have medications that we can administer. As time goes on, those things are really not sustainable, so we've developed blood biomarkers to look at Alzheimer's. What Dr. Feng is telling you is that there are other things that we can look at that are far less expensive. And gait, how many of you knew that changes in your gait would reflect brain changes as well? How many of you knew that? I got one question for you. If you walk more and you do better, then that make our brain better?
Not necessary. Because we have been working since we were toddlers, so we just keep working. So like that motor task, events like complex motor tasks, but our brain already used to it. So we want to engage so too many functions in the brain to enable ours to work. But if we do the sleep perturbation or treat perturbation, so that could help because that's like a new different stimulation to the brain. It's probably that could help to some degree. But I don't know that yet. It's just like a hypothesis. So we needed to conduct more research or to examine it.
Can you tell us a little bit more about the fall prevention study you're doing and how does that help us?
So yeah, we do fall prevention. Basically, we are trying to develop like new or different interventions to prevent the falls for people with Alzheimer's or MCI. So yeah, we use like one of the interventions we use is we call perturbation training. Just like I showed you, so we use the sleep or treat perturbation on the treadmill. The theory is when we were young or when we were toddlers, we were trying to learn how to walk or how to run. So during that process, then we failed like so many times. But after falling like so many times, we no longer fall. So the reason is that our brain was able to develop the necessary skills which can prevent us from falling. But as we age, or due to the damage to the brain because the disease, neurological disease like the Alzheimer's disease, so that the capacity could be compromised. So then we were thinking if we can develop like a safe environment in which we force the people to fall, to ask them to re-experience the falling. So we humanity can help them to regain or remove the skills lost to the damage to the brain. So that's why we use this treatment to make people fall after either sleep or trip. So like among the healthy old adults, we have seen like a very encouraging results, even including in people with multiple sclerosis. So after the training on the treadmill, by using the sleep or trip, we have seen like a significant reduction in their real life falls. So that helps us, the participation training can help us to relearn the motor skills, which can be used to prevent the falls. So this is like one of the interventions we are using. Another intervention we call is like a vibration training. So the vibration training is very simple, very safe. You can do it here at home. So basically, we use like a vibration platform. So when we turn that on, so basically during the training, you just stand on the platform. When you turn the machine on, the machine will deliver like a very fast but a very small in the magnetic like vibration. So this mechanism stimulation can be transmitted to all the muscles. So after like a long-term training, about 6 or 8 weeks, so the training can increase the muscle strength. It can also improve the balance, improve the sensation. So all those things are related to force. So if we can improve those like factors, then the fall risk will be reduced. So currently we are doing vibration and the participation training to reduce force. We have seen like a good result. Now we are trying to transfer all these training paradigms to people with Alzheimer's or mild cognitive impairment.
The microphone.
Our bathrooms have porcelain, marble, and it is one of the most dangerous spaces coming out to the shower. So, do you have anything to add or any technologies that are for seniors as we're taking showers and using our bathrooms?
Yeah, that's a good question. We know that home environment is a potential hazard to increase the fall risk. I think based on the CDC data, the bathroom fall is one of the most prevalent place for the falls, especially in the seniors. So the advice I'll probably is just make sure you have make your surface is like less slippery, and also you have some handrail on the walls. And if you have the complete a resource, probably you can consider the bathtub without the bathtub. You can, I think it's called like step in or like step in that one, but reduce all the other hazard. So that's like all.
Hey, Dr. Feng, just to add to that, for anybody who wants to know what you can do to fall-proof your home, an occupational therapist, you can get a consult with an occupational therapist to come into your home and do like an environmental assessment to see what kinds of adaptations need to be made. He alluded to the step-in shower or bath. He also said, what can you do to make it slip-proof at handrails, things like that. AARP has a menu. You can go onto the AARP website, and they have things that you can do and look at to help you modify your home. But immediately available to you is to seek the services of an occupational therapist. It's a very specialized area of physical therapy where they will come into your home and do an occupational therapy evaluation for fall prevention. That's accessible to anybody here, and it's something that's payable via Medicare.
You may have already answered this question, but are there certain types of physical activity like martial arts where it teaches you how to stand, move, how to fall? But someone who's suffering early onset, would that be helpful?
Yeah. So I think any exercise will be helpful. Okay? So just keep yourself physically active. It may, if you keep yourself like physically active, okay, so then probably you can maintain your strength. Okay, so then because strength is so important, okay, for our the mobility, okay, to move around and maintain our independence. So the strength is very essential. Okay, so if you you do some martial arts, tai chi, so those things can not only strengthen your muscles, it can also improve your balance. Okay, so definitely, you should engage yourself in those type of exercises, because those exercises are not like very physically demanding. Okay? So you can do them like slowly, but you can still benefit from them.
I just had a quick one. You had mentioned AARP coming in and doing an assessment, but I just recently purchased from Amazon. They come in 2 days. The suction shower handles. I put those on my walls, and I'm a big dude. And
they're not coming off the wall.
They are not. They were not. I pulled on them. That's why I
Thank you for that information, because that is important. There are things that you can get on Amazon that can make falls less likely. But I do want to caution you that sometimes those suction cups don't allow and you fall. So I'm not going to counteract. I'm just trying to put this little extra in here, Mr. Turbo.
I had towels on my wall, and they're the 3.5 inch towels, and that's about the smallest raise you get for this suction. And I put them on there, and lo and behold,
you're special. You just special. Okay, got. I do want to be careful about some of that stuff, because if you're a big heavy person, those suction cups are not going to hold. And so the grab bars that you insert should be really well grounded into the wall or the surface. So, getting up on your stairwell, that should be a suction cup. It should be into the beams and the walls so that they can support your height. Some of us are petite, some of us are a lot bigger. And we need a little bit more support. But again, and occupational therapists, I'm just going to say this, aren't really fond of those suction cups for all the things that we've explored. But an occupational therapist can come into your home. And I think that there are some tax advantages to making certain adaptations in your home to keep you from falling, like inserting the handrails in your shower, on your stairs, and creating ramps even.
for a individual, is a fall normally consistent for an individual? Like, do they fall to the left, do they fall to the right, they fall forward, they fall back? And is that cognitively related, or is that biomechanically related?
Yeah, that's a great question. So but false, so false would happen because like some triggers. Okay? So environmentally, let's say if your surface is slippery, okay? Or if you step on like stairs, okay? then you lock yourself or trip yourself. So if you trip yourself, probably you will fall forward. If you slip yourself, probably you fall either backward or sideways. So that's if the falls are the results of the environmental factors. So that can determine the way you fall on the ground. But if it's like the cognition related, it could it could be, for example, if it depends. For example, it depends where the brain lesion is, left or right. So then the control different brain section control different body parts. So it could affect or indicate if you keep falling to the same direction or in the same situation, that could be related to the damage of lesion in the brain.
How many more questions? How many more?
Oh, about 2 or 3 more. Yeah, we have 2 or 3 more.
Yes. I just wanted to share with the group. I participated I take a Tai Chi class once a week, and it does help. A lot of the your senior centers. I take one particularly at Southwest Arts Center. I've been taking it for about maybe a year now, and it's once a week. It's free, so we can just reach out to maybe even some of your home owners association. You can contact different teachers around or look online. Also, video. What Silver Sneakers has a video that you can go to the website. So that's one of the things we can do. It is inexpensive. And one of the things the gentleman mentioned about handrails and all, I was in construction for many years, and I've installed or remodeled a lot of seniors' homes. You really do need to mount your handrails, step in, making sure it's proper construction and mounted to walls. Not to say that some of the things that you buy online is not good, but to be up the code that you want to do mounted properly. That's with mounted studs, like she mentioned, bolts and what have you. So it's a lot of information around there. So that's what I want to share with a lot of things we can do with when it relates to health issue and physical activity is free around. Just have to do some research. AARP is one. Thank you.
Perfectly. That is true. I mean,
Hold on, this gentleman had a question.
My question is this: is there a relationship between height and falling? An example: as we get older, they tell us don't climb ladders. Is that a function of cognitive impairment, or is that?
Yeah, that's just balance. Okay. We need to start.
Did everybody hear the question? It's sort of like as you get older, should you climb ladders, etc., right? You're too tall. Oh, okay. Let's cognitive impairment causing the inability for you to scale heights, climb ladders and things. So that's what you're asking. Alanda, try that question.
Yeah. Probably I misunderstood the question. It's like if the body height has anything to do with the body. So the body height indeed could change the body risk, but it's changed in a different direction. So we have found that the taller the person and the body risk would be smaller. The reason is the taller person used to have a bigger foot. So the foot is the bigger of your base of support. So then when I'm standing here, I have the base support, which is the area between my foot and the ground. So the taller person, the bigger the base support. So the bigger the base support, then the more stable the person would be. So that's what we found in our plan. But then coming to your question here, I'm not very clear if the cognition level would be affected by the height the person resides here. I think probably there could be some issue, but yeah, I don't recommend you to climb to the landscape. Because the fall escape from the land or from the roof is one of the leading cause of the increase in the workspace, even for construction workers. That's a leading cause here. So again, I don't recommend you doing that.
Sorry. This is the last official question.
Yes, I heard about the occupational therapist, but this morning at 4:30, I take care of a parent, 42 years old, hospice. Somehow she got out of bed, made it to another room, then she fell. Is there anything that you can tell me, maybe how to keep her in the bed before she can start walking around?
I think
She has dementia. She has dementia. So
Yeah. So I think that's a phenomenon. It's called the wandering in people with dementia. It's not a equivalent phenomenon. So in another industry, they are trying to invent some technologies which can monitor individuals, and they even use some GPS sensors to locate the person. If the person moves away from the designated area, let's say by 10 feet or something, that can trigger alarm. So then the health provider or the caregivers, they can be notified of this, then they can intervene. So that's a very common thing. So, but yeah, you can use some technologies here, or otherwise probably you can put a bell ring or something on the door. If she or he open close the door, you can hear the ring and then do something to themselves.
About doors, but there are also bed monitors that you can purchase that let you know that the person's out of bed. In hospitals, in nursing homes, when we have people who are like your mom, we can't tie them down anymore. That's illegal. You can't tie them down. So think you can tie them down. That's not good for them, and it has other consequences. But there are bed monitors that were developed here at Georgia Tech that you can use to let you know that people are up out of bed. And that's also a question. I said occupational therapist. We probably need to put you in touch with Maureen Burke to help you navigate that a little bit better. Does she get up out of bed all the time?
This just happened this morning. But
She was on that a lot, right?
No. It's happened. It happened today, but it's happened about 5 times.
And that's
then she falls down.
Break something.
Yeah, she falls down every time. That's the way I woke up this morning. I heard her fall. She was in another room. How she made it to another room, I have no idea.
Your sister got all over you, didn't she? Okay, that's it for questions. Thank you, Dr. Feng. And a complementing study. And particularly nothing, understand that gait change is a sign and symptom of brain dysfunction. We've got research studies for you.
Popper, you grew it. Yes. Favor. Feelings of putting them in the sun. And now quite now is any metals affect them. Break and speak of speak.
I can't. But if you're a veteran, a service-connected veteran, and if there are problems with mercury and that becomes a service-connected disability, I don't know enough about that, but I am aware of that. And I think it has a lot to do with the amount of mercury that is found. And I think that there are some investigations taking place somewhere that have to do with that. But I can't say that all the metal fillings that any of us have ever gotten are putting us at risk for Alzheimer's. I think that's the bottom line question, right? More like habits. That's more about that. Okay?
If we wanted to be tested, would it be just called
To be tested for fall?
crawling or?
Okay, so testing for falls, okay. None from the research side. Physical therapists and occupational therapists will test your gait. and we'll examine your gait and see what you need to do for fall risk. What we learned today was that brain dysfunction, brain deterioration is consistent with changes in your gait. But if you want your gait tested, he's offering you that opportunity to research. A physical therapist in your community can also assess your gait, and that would be covered under veterinary. Yeah, doctor has to order it. So a physician has to order a gait assessment for you from the physical therapist. And it would be covered by your Medicare, your health insurance. Dr. Feng?
But if you are interested in our study, we will do the gait assessment for you for free. Because that's like we will not only do the gait assessment for free, we will do a full body composition scan, DEXA scan for you. We will also do a full risk assessment for you for free.
Healthcare, bone density. I don't know if you heard of that. Okay, if you have fragile bones, that's why they do a DEXA scan, bone density. That's an expensive test, but he's giving it to you for free. So I think you put the QR code up there before. So sometime later, Chris will go back and redo it. So he's saying that through this study, you get a gait assessment, a bone density. What else? What's the last?
For risk assessment.
Fall risk assessment.
And also, we will do the perturbation training or vibration training that could reduce your fall risk.
Okay. All right, and we'll put that QR code back up there. They even pay you $50.
It's $25 per hour. Okay, if you are still with us for 4 hours, maybe $100.
Can we get another round of applause for Dr. Yang? Go, Ray. Thank you so much, Dr. Yang.